I'm Dr. John J. Smith with Susu Health Foundation. In our last video, we encourage you to get your COVID-19 vaccine using any vaccine that's available to you. I've been following the news about the vaccines very closely. And with all the news lately about blood clots being associated with both AstraZeneca and Janssen Johnson, I've had some conversations with people offline who have some very valid concerns about these vaccines. So, I wanted to do this video to just share some information about the blood clots, and I hope this helps. Now, usually when we hear about blood clots, you think about the type that form in the deep veins in your legs and can travel to your lungs, right? The clots that have been seen after the vaccines aren't the usual clots. So they're forming in places like in veins in the brain and in the abdomen, in the gut. And the people who are getting these clots also have low platelets. Platelets are the cells in your blood that actually help your blood to make clots. So they're making clots, but they have low platelet counts. And what they found with AstraZeneca is that the clots that we see with AstraZeneca are very similar to what we see in a drug reaction to a medication called heparin. Heparin is a blood thinner. So when people come into the hospital and have a blood clot in their leg, we treat them with heparin to treat that blood clot. Some people who get treated with heparin can have a reaction to the heparin that can cause them to have low platelets and form clots. And that's the same thing that we've seen with AstraZeneca. So Janssen Johnson and AstraZeneca are similar. They're both vector vaccines using a virus vector. So it's most likely what's happening with the Janssen Johnson vaccine is the same. These clots are serious, right? We're talking about clots that form in the brain and things like that. But they are very rare. And what that means is although they could happen, the chances of them happening are very low. So let's look at some numbers. In this slide, and I'll try to stand out of the way here so you can see all the numbers. We see the risk of clots with AstraZeneca and the Janssen Johnson vaccines in the box on the bottom. And what you see is with AstraZeneca, there were 222 cases of the vaccine, but that was after a whole 34 million people were vaccinated. With Janssen Johnson, we've had 6 cases after almost 7 million doses of the vaccine. Now let's look at some other situations. So when we look at blood clots in the brain, just in general, not in people who've had a vaccine, just random, people in the general population, we see that in 2 to 4 people out of 1 million. COVID-19 infection and the rest of the things on this list. Now these are not just looking at blood clots in the brain, but in other areas. So you see that the COVID-19 infection itself has a much higher risk of blood clots than what you get from the vaccines. And then you look at things like birth control pills, cigarette smoking, plane rides, lasting longer than 8 hours. All of these things have a risk of blood clots, right? But even with the risk of blood clots after a long flight, we continue to travel because it's about looking at the risk of these things happening and the benefit to you. Now that we've looked at the numbers, let's talk about what this means. From a public health perspective, these clots are rare events, meaning there's a very low chance that they could happen. But I understand that when we're talking about you, the individual, this is scary because this stuff is serious. So what do we do with this information? Like I said before, it's all about looking at the risk and the benefits and making the best decision for you, the individual. So what we do know about these clots is that they have mostly happened in young women. So with the AstraZeneca vaccine, it was mostly women under the age of 60. The 6 women who have clots after Janssen Johnson are all between the ages of 18 and 48 years old. And these clots usually happen within 2 weeks of getting the vaccine. Now, AstraZeneca is not used in the US, but it is the COVID vaccine that we have in Liberia, in other African countries, and in other places around the world. Several countries in Europe stopped using AstraZeneca temporarily last month because of concerns about the clots. And of course, that caused a lot of concerns. I have people calling me and going, this is exactly what I was worried about. So the vaccine isn't good enough for them, but it's good enough for us here in Liberia. But here's the thing. They stopped it temporarily. They looked at the numbers. They looked at the data. And then a lot of these places have actually started using AstraZeneca again. But based on the numbers, they've used it with some minor changes, right? So for example, in Spain, Italy, and Germany, they are using the vaccine, AstraZeneca vaccine, in people who are over 60 years old. They're not using it for young people. Similar thing in Canada, where they're using the AstraZeneca vaccine for people over 55. Now, so just like these other countries temporarily stopped using AstraZeneca last month, this is the same thing that we're seeing here in the U.S., where we've had a pause in using Johnson & Johnson, with these with the cases in these 6 women. Now, does that mean that the vaccine is not safe? The answer is no. Because again, from a public health perspective, this is a rare thing, right? Compare it to the chances of you getting struck by lightning. The risk of getting struck by lightning in a given year is 1 in a million. So when we're looking at 6 women in 6.8 million vaccine doses, that's close to that 1 in a million, right? So it's low, it's a low risk. But what does that mean for you? Because 1 in a million is rare, but when that one person is you, or it's somebody you know or somebody you love, then that changes things, right? So should you be concerned? My answer to that is it depends. Well, John Jay, it depends on what? It depends on your risk, your underlying health, your age, and also what options do you have for a vaccine. So remember that the blood clots happened in, women under 50 if we're talking about Johnson & Johnson, and women and people under 60 if we're talking about AstraZeneca. So here's my take. If you are under 60 years old, especially if you're a woman, and you live in a place where you have other options for a vaccine, then use your other option. Get your Pfizer, your Moderna. If you live in a place where you don't have other options, then you need to start looking at what are the pros and cons of me getting this vaccine versus me not getting it. And that's where you have to look at your personal health, look at what is your risk of getting COVID, and have that conversation with your doctor. So somebody asked me, well, okay, you keep talking about all these numbers. What about you, John J. Smith? Like, what would you do? Now, I am in my mid-40s. So I'm in that age group that's high risk for getting a blood clot. I've already had my Moderna vaccine, right? But if I didn't have my vaccine, I would actually be looking to get Pfizer or Moderna just based on the age group of the women who were affected by the clots, in these cases that we've seen. But what if I live back home in Liberia? What if I was back home where AstraZeneca is pretty much my option? Then I would look at it like this. I work in healthcare. I'm seeing patients. I also volunteer at a vaccine clinic. So I have a high enough risk of being exposed to people who have COVID and may not even know yet that they have it, that I have to think about what do I need to do to protect not just myself, but my family. So, when I look at the risk being 1 in a million, I would go ahead and get vaccinated. Now, would I be worried? Absolutely, yes, of course. That voice would be in the back of my head. Are you sure you want to do this? 1 in a million? What if you are that one? So that little voice would be there the whole time, and I would be worried. I would do a lot of praying, but I would get it because of my risk. And, based on everything that I have seen and what I've learned and what's important to me, which is protecting myself, my family, and the people around me. So the bottom line is, please talk to your doctor and let the data and the science, help that conversation. and then just look at the risk and benefits specific for you, the individual. Okay? Now, what if you've already gotten your vaccine? You've already gotten Johnson & Johnson or AstraZeneca. What are the symptoms of the blood clots that you should look for? So, in the previous video, we talked about the usual symptoms, side effects, of the COVID vaccines. And it's things like pain and swelling at the injection site, tiredness, headaches, fevers, chills, nausea. Well, the symptoms that, would be concerning and would make you worry that you might have one of these clots would be if you have a horrible, terrible, severe headache, a really, really bad headache. If you have abdominal pain, so your stomach really hurts. If you have leg pain or swelling, or if you have shortness of breath and just feel like you can't breathe, you can't catch your breath. Those are all symptoms of blood clots. And those would be reasons to go in right away to the nearest emergency room. Okay? Now, where can you report these side effects if you have side effects from the vaccines? Now, if you have just a mild reaction and it's not an emergency, you can contact the site where you got your vaccine, or you can go to your doctor. You can call your doctor's office. If you have a severe allergic reaction where you're having trouble breathing or anything of that sort, you need to, if you have any ambulance service available, call the ambulance, call the emergency medical service, or go to the nearest emergency room. I have information here for where you can report side effects related to Johnson & Johnson vaccine and AstraZeneca. And I will copy and paste this information in the chat below so you're able to just click the links to access them. But the bottom line is, if you're having a severe allergic reaction, I am not saying at all that you should be online trying to find a website. Go to the emergency room. These options for reporting are once you're over that emergency. Okay? So I really hope that this was helpful to you. Thank you so much for watching this video. If you want to, be updated with information from us as it comes along, please subscribe to our YouTube channel. You can join our mailing list. Just send an email to info@susuhealthfoundation.org. Follow us on social media. I have all of our social media channels listed here. And yes, I'll keep you updated as new information comes out. Thank you for watching.